Welcome to PlacidWay Pulse, your trusted source for exploring global healthcare, wellness innovations, and life-changing medical travel opportunities.
It's really great to be here to unpack all of this.
Yeah, and in today's deep dive, we're taking you to Thailand. It's one of Asia's leading destinations for regenerative medicine and wellness-focused healthcare.
Right. The growth there has been just explosive over the last few years.
Exactly. We'll explore how stem cell therapy is being used to support longevity, healthy aging, and just overall wellness through advanced treatment approaches available at these internationally recognized medical centers.
And we are talking about some truly cutting-edge facilities.
Oh, absolutely. So whether you're researching preventative wellness therapies, anti-aging solutions, or innovative regenerative treatments, this deep dive offers a practical overview to help you better understand your options.
Because there's a ton of information out there. And, it can get overwhelming.
It really can. I mean, right now, someone is boarding a 15-hour flight to Bangkok, not for a vacation, but to have millions of, day zero umbilical cord cells infused directly into their bloodstream.
Yeah.
And they're doing it because a highly calibrated regenerative treatment that would easily cost them $50,000 in the United States or the UK is going to cost them roughly $5,000 in Thailand.
Which is just a massive paradigm shift in global healthcare geography.
Right.
We are looking at a fundamental rerouting of how patients seek treatment. People aren't just crossing oceans for cheaper bypass surgeries or, discounted dental implants anymore.
No, the motivation has totally changed.
Exactly. They are seeking out highly advanced regenerative medicine, specifically stem cell therapies. And they're doing it in environments that are entirely optimized for wellness, longevity, and physiological recovery.
And if you're navigating a chronic illness or dealing with the wear and tear of a major joint or actively researching longevity protocols, you've probably already stumbled into the deep end of this internet rabbit hole.
Oh, it's a deep rabbit hole for sure.
Yeah, the sheer volume of data, the wildly varying price tags, and the dense medical jargon, it can feel completely overwhelming.
Definitely.
So that is the mission of our deep dive today. We are unpacking a massive stack of data provided by PlacidWay, which is a premier resource in global healthcare and medical tourism.
And the data from PlacidWay is incredibly illuminating because it strips away the marketing veneer,
Right. It gives us the actual clinical pathways. We've got their comprehensive clinic directories, patient resources, cost breakdowns, recovery protocol.
All the vital logistics.
Exactly. And we're going to synthesize all of this to figure out exactly what is happening in the Thai medical sector, completely free of confusing medical jargon.
And what that data highlights is a critical evolution. We're seeing a global shift toward preventative, restorative healthcare.
Which is huge because for a long time, traditional medicine has been highly reactionary.
Very much so. You wait until the joint is bone on bone, and
Right.
then, you replace it with titanium. Or you wait until the pancreas fails, and then you inject synthetic insulin. But the data we are looking at today represents a proactive approach. It's about leveraging biology to repair the physiological foundation before the structure collapses.
Okay, let's unpack this. Because before we even look at flight prices or clinic accreditations in Phuket or Chiang Mai, we have to understand the actual biological payload.
Yeah, the medicine itself.
Right, because if you are going to let a needle near your spine or your bloodstream, you need to know exactly what is inside that syringe.
Absolutely.
So let's talk about stem cells. A lot of pop science articles refer to stem cells as the body's, construction workers.
Which is a very common analogy.
Yeah, but looking through the clinical literature here, that analogy feels a bit too basic. It implies they just show up and start acting like bricks and mortar.
Right, like they physically become the wall.
Exactly. But from what I'm reading about mesenchymal stem cells, or MSCs, it seems more accurate to describe them as cellular general contractors.
That is a much more accurate framework, yeah.
Because they don't just do the heavy lifting, right? They show up at the site of an injury, survey the biological damage, and secrete chemical blueprints.
Yes, specific growth factors and proteins.
Right, and those blueprints force your local dormant cells to wake up and get to work.
You are touching on a mechanism known as paracrine signaling. And for a long time, the medical community actually believed the construction worker theory.
Wait, really?
Yeah, they thought that if you injected stem cells into a damaged knee, those specific injected cells physically morphed into new cartilage cells.
Oh, wow. But that's not what happens.
Well, we now know that while some differentiation happens, their primary value is as biological managers.
Managers.
Right. They release exosomes and cytokines into the surrounding tissue environment. So if an area is highly inflamed, these signaling molecules instruct the local immune cells to just stop their aggressive inflammatory attack.
Okay, that makes sense.
And simultaneously, they stimulate angiogenesis.
Which is the creation of new blood vessels, right?
Yeah, exactly. To increase blood flow to the damaged area. So they are orchestrating the repair rather than just acting as the raw material.
Which makes the source of these contractors the most critical variable in this whole equation.
Oh, without a doubt.
Because the PlacidWay directories show clinics offering two very distinct categories of cells, autologous and allogeneic.
Yes, the two main avenues.
And the path a patient chooses dictates the cost, the procedure, and, the biological potential of the whole treatment.
Absolutely.
Let's start with autologous. This is a closed loop, right? The clinic harvests the cells from your own body.
Correct. And the most common method for autologous extraction shown in these protocols is through adipose tissue.
Basically, your body fat.
Yeah, exactly. A physician performs a very minor liposuction, usually on the abdomen or the flank, because fat tissue is incredibly rich in mesenchymal stem cells.
Okay.
They exist in what we call the stromal vascular fraction of the fat, or alternatively, they can be drawn from the bone marrow.
From the hip, usually?
Right, typically from the iliac crest of the hip. The clinic then takes that sample to a laboratory, isolates the stem cells, concentrates them, and prepares them for reinjection.
So the obvious upside here is biological compatibility. I mean, if they are your cells, your immune system instantly recognizes the biological passport.
Exactly. There is zero risk of rejection.
No graft versus host disease, no concern about allergic reactions to foreign tissue. It's a very safe profile.
Very safe.
But the data points to a massive biological catch here.
The age factor.
Yeah. If I am 65 years old and I have spent 3 decades battling systemic inflammation, a poor diet, environmental toxins, my internal stem cells are also 65 years old.
You've hit on the exact limitation of autologous therapy for older or chronically ill patients. We call it cellular senescence.
So they're just exhausted.
Essentially, yes.
Yeah.
As we age, our stem cell reserves naturally deplete, and the ones that remain, well, they lose their vigor. They have suffered from telomere shortening. They have oxidative damage. Their ability to multiply rapidly and secrete those vital paracrine signals diminishes significantly.
So if you are asking a tired 65-year-old cellular contractor to orchestrate the rebuilding of a severely degraded knee joint,
The biological response is going to be muted. It just won't be as robust.
which brings us to the second highly sought-after option driving a lot of this medical travel, which is allogeneic cells.
Right, donor cells.
And in the context of the high-end Thai clinics we are analyzing, they are predominantly harvested from human umbilical cord tissue, right?
Yes. Donated by healthy mothers after healthy full-term cesarean deliveries. We are talking about day zero cells.
Day zero. That sounds incredibly potent.
The regenerative potency of umbilical cord-derived mesenchymal stem cells is just extraordinary. Because they are so young, they haven't been subjected to decades of environmental stress.
So they're basically a blank slate.
Pretty much. They have long telomeres,
Yeah.
meaning they can replicate rapidly.
Mm.
And they secrete massive volumes of anti-inflammatory cytokines and growth factors. But the most fascinating aspect of these specific cells, and why they are so valuable for systemic treatments, is that they are immune privileged.
Okay, I want to focus on that term, immune privileged, because it sounds completely counterintuitive to me.
How so?
Well, if I receive a kidney from a donor, I have to take harsh immunosuppressant drugs for the rest of my life so my body doesn't attack the foreign organ.
Right.
So why doesn't the body attack these umbilical cord cells? I mean, they belong to someone else.
It's a great question. It comes down to cellular markers. Adult cells have specific proteins on their surface called human leukocyte antigens, or HLA markers.
Okay.
It is essentially a cellular ID badge. If your immune system sees an HLA badge that doesn't belong to you, it attacks.
Like a bouncer at a club.
Exactly. But umbilical cord MSCs have an extremely low expression of the specific HLA class 2 antigens that trigger that immune response.
No way. So they don't have the badge.
They essentially wear an invisible ID badge. This allows them to enter a patient's body, circulate, and perform their immunomodulatory and repair functions without immediately triggering an aggressive immune rejection.
That is incredible. But, the natural skepticism you or I might have here is the permanence of this.
The Band-Aid question.
Right. Are these treatments actually curing diseases, or are we just putting a highly advanced biological Band-Aid on symptoms? Like, If I get an injection for severe joint pain, are the cells just numbing the localized area for 6 months before the pain comes roaring back?
It's a critical distinction to make. A traditional corticosteroid injection, that is a Band-Aid.
Okay.
It chemically suppresses the inflammatory response and masks the pain,
Huh.
but it actually contributes to the long-term degradation of the cartilage. It damages the tissue over time.
Wait, really? The cortisone damages the joint?
Over repeated use, yes. But stem cell therapy aims for structural disease modification.
Meaning it's fixing the actual root cause.
Yes. By stimulating the proliferation of chondrocytes, which are the cells that make up healthy cartilage. And it downregulates the pro-inflammatory enzymes in the joint fluid.
Okay.
So it is actively attempting to halt the degradation and rebuild the tissue matrix. The reduction in pain is not from a numbing agent.
It's just a direct byproduct of the joint actually functioning better mechanically.
Exactly. It's an improved structural integrity and a healthier biochemical environment within the joint.
That fundamentally alters how we view chronic pain management. So the underlying biology is universal, right? An umbilical cord cell behaves the same way biologically, whether it is administered in London, New York, or Bangkok.
Biology is biology, yes.
Which brings us to the economics and logistics detailed in the PlacidWay data. Because if the science is universal, why are patients flying across the globe instead of going to their local clinic?
The financial reality.
Let's look at the financial disparity because it is the primary catalyst for this global movement.
Yeah.
The numbers in the directories are just stark.
Yeah, they really are. The cost differential is staggering, and it requires a nuanced understanding of global healthcare economics.
Yeah, because in the U.S., a comprehensive bone marrow stem cell therapy can hit $50,000.
Easily.
But in Thailand, the PlacidWay data shows these stem cell therapies generally ranging from $2,500 to $15,000.
It is frequently 50 to 70% cheaper than the US, the UK, or Australia.
We are talking about a fractional cost for the exact same biological material. Now, if you are calculating your budget, the immediate psychological hurdle is the assumption that a lower price point necessitates a lower standard of care.
The old you get what you pay for mentality.
Right. We are conditioned to believe that a $5,000 treatment must mean a back alley clinic with questionable hygiene.
And that assumption is the biggest misconception in modern medical travel.
I figured.
The price disparity is not a reflection of compromised clinical standards at all. It is a reflection of macroeconomics.
Okay, bring that down for us.
Well, Thailand has a significantly lower overall cost of living, which translates to lower overhead for facilities, lower administrative costs, and drastically different medical liability and malpractice insurance frameworks compared to the highly litigious environment in the United States.
That makes a ton of sense. The insurance costs alone in the U.S. must be astronomical.
Exactly. Furthermore, the Thai government has actively subsidized and promoted medical tourism as a core economic pillar for decades. They have deliberately engineered these centralized, high-tech healthcare zones.
And the clinics catering to this international influx, they aren't operating in the shadows. The PlacidWay directories constantly highlight specific accreditations, primarily JCI.
Yes.
If a listener is vetting a clinic, JCI seems to be the absolute baseline requirement, right?
Absolutely. JCI stands for Joint Commission International. It is the global benchmark for patient safety and healthcare quality.
So what does that actually mean for the patient?
It means if a hospital in Bangkok holds JCI accreditation, they are subjected to the exact same rigorous granular auditing process as a premier research hospital in Boston or London.
Wow, the exact same standards.
Yes. The auditors look at everything from the sterility of the surgical suites and the chain of custody for biological materials to the specific air filtration systems in the laboratories.
Because when you are processing live human cells, you can't just do it in a regular room.
No, you must have state-of-the-art, GMP-certified clean rooms. GMP stands for Good Manufacturing Practice. And Thailand has heavily invested in building this exact infrastructure to appease international regulatory standards.
The data also highlights clinics like Vega Stem Cell Clinic or eDNA Wellness in Bangkok. And what stands out isn't just the lab equipment, but the overarching philosophy of the patient experience.
The med holiday concept.
Exactly. The literature refers to it as the med holiday. They are actively integrating highly advanced cellular therapy with luxury hospitality. It's like getting your car's engine rebuilt, but instead of waiting in a dingy garage, you're recovering in a 5-star resort.
That's a great way to picture it. And that integration is not merely a marketing gimmick. It actually serves a profound physiological purpose.
Wait, really? recovering on the beach is medically beneficial?
Oh, absolutely. Think about the standard domestic medical experience.
Okay.
You are dealing with insurance bureaucracy, navigating awful traffic to a sterile, brightly lit clinic, sitting in a crowded waiting room, and then rushing back to your job or family
Right.
obligations.
You're just stressed out the entire time.
You are in a constant state of low-grade chronic stress. Your sympathetic nervous system is firing on all cylinders.
You are flooded with cortisol.
Precisely. And cortisol is a potent immunosuppressant. It actively inhibits the cellular repair mechanisms we are trying to trigger with the stem cells.
Oh, wow. I never thought about that.
The med holiday deliberately removes the patient from that toxic environmental stressor. By recovering at a 5-star facility in Phuket or overlooking the mountains in Chiang Mai, the environment actively shifts the patient's autonomic nervous system into a parasympathetic state, the rest and digest mode. Exactly. Lowering systemic stress hormone levels creates a vastly more hospitable biochemical environment for the infused stem cells to engraft, signal, and begin the intensive work of tissue repair.
That reframes the entire experience for me.
The tranquility of the environment is actually a vital component of the medical protocol.
So the recovery on the white sands of Krabi isn't just a vacation you take after the medicine. The low-stress environment is acting synergistically with the medicine.
Yes, it's all connected.
Okay, so we understand the biology of the cells, and we understand the economic and infrastructural draw of Thailand. Let's dig into the specific ailments that are filling these clinic waiting rooms.
Let's do it.
I want to start with the physical framework, orthopedics, and severe physical trauma.
Orthopedics is where regenerative medicine has the longest track record and some of the most robust clinical data. It is the entry point for millions of patients dealing with the inevitable mechanical breakdown of the human body.
Yeah, and the most common application shown in the data is osteoarthritis, specifically chronic knee pain. We are talking about the gradual destruction of the articular cartilage until bone just grinds agonizingly against bone.
It's incredibly painful and debilitating.
The PlacidWay data shows targeted joint treatments ranging from $2,000 to $8,000. But how are they actually executing this? They don't just blindly jam a needle into the knee, right?
No, precision is paramount.
Yeah.
A high-tier clinic will utilize advanced ultrasound or fluoroscopic guidance.
Okay, so they can see exactly where they're going.
Right. The physician watches a live imaging feed to ensure the needle penetrates the exact millimeter of the joint capsule. They are delivering the concentrated stem cells directly into the synovial fluid bathing the damaged cartilage.
And once the cells are in there,
Once inside, the cells immediately begin down-regulating the pro-inflammatory cytokines that are causing the swelling and pain. Concurrently, they release factors that stimulate the patient's native chondrocytes to begin laying down new extracellular matrix.
it is a highly localized precision strike against degenerative disease.
Exactly.
But the clinical applications extend far beyond a worn-out golf knee. The data features extensive protocols for profound neurological trauma. Let's look at spinal cord injuries, or SCI.
This is a highly complex area.
It is one of the most devastating injuries a human body can sustain. And the directories outline specific packages, like a program at Vega Clinic for SCI that runs roughly $12,500.
If we connect this to the bigger picture, this is an area where we must be incredibly grounded about the neurological reality. We have to clearly define what success looks like in the context of central nervous system damage.
Right, expectation management.
Exactly. A spinal cord injury involves the severing or crushing of complex neural pathways and the subsequent formation of dense scar tissue that blocks electrical signals from the brain to the body.
So when a patient pursues stem cell therapy for SCI,
They must understand that a miraculous full recovery, a completely paralyzed individual standing up and walking perfectly normally out of the clinic, is not supported by the current standard of data.
Yeah.
It is an unrealistic expectation.
right, if we look at the clinical studies referenced in these tourism guides, the success rates hover around 40 to 50% for what the literature calls functional improvements.
Yes, and functional improvement has a very specific medical definition here. We are not talking about reversing the paralysis entirely. We're talking about marginal but vital gains in neurological function.
How does that work mechanically?
The infused stem cells, typically delivered via lumbar puncture directly into the cerebrospinal fluid, act to reduce the chronic neuroinflammation at the injury site. They may promote remyelination.
That's repairing the protective sheath around surviving nerves, right?
Exactly. And they offer neuroprotection to prevent further cell death.
So what does that actually look like for the patient in their daily life? If the success rate for a full cure is so low for spinal injuries, why are patients still traveling for it?
Neurologically, A functional improvement might manifest as a return of partial sensation, the ability to feel a shift in temperature or just the pressure of clothing against the skin.
Wow.
Motor-wise, it might mean regaining enough core strength to sit up unassisted in a wheelchair or regaining fine motor control in the hands and fingers.
Which is huge.
Crucially, many patients report a significant reduction in debilitating neuropathic nerve pain and a decrease in the severe muscle spasticity that constantly racks their limbs.
Okay, but if someone is looking at a $12,000 price tag plus international flights and the highest probability outcome is only a partial functional gain.
Because you have to evaluate the gain through the lens of a patient whose life has been radically restricted.
Right, context is everything.
For an able-bodied person, gaining a fractional amount of hand strength seems negligible. But for a quadriplegic patient, gaining the fine motor control to hold a fork and feed themselves, or to operate a motorized wheelchair independently.
That's a monumental reclamation of human agency.
It absolutely is. Reducing severe nerve pain so they can sleep through the night without heavy narcotics transforms their daily existence. When these biological interventions are paired with the intensive daily physical rehabilitation that Thai clinics package with the treatment, patients can maximize those neurological gains.
It is about fundamentally altering the quality of life, not achieving perfection.
Reclaiming agency, just as you said.
That perfectly encapsulates the value proposition.
Yeah.
And it makes intuitive biological sense to target a localized injury, injecting cells into a bad knee or the cerebrospinal fluids surrounding a damaged spine.
Right, local delivery for a local problem.
But as we move through the PlacidWay directories, a massive portion of the treatments are dedicated to systemic overhauls. We are talking about treating chronic, body-wide autoimmune and metabolic diseases.
Yes, a totally different approach.
How do you inject a localized medicine to treat a systemic failure?
You transition from a localized injection to systemic delivery, utilizing the body's own vascular superhighway.
The bloodstream.
Exactly. For these complex conditions, the stem cells are typically administered via an intravenous or IV drip over the course of a few hours,
allowing them to circulate throughout the entire body.
Once those millions of cells enter the bloodstream, they don't just float aimlessly. They respond to chemokines.
What are chemokines?
They are distress signals emitted by damaged or inflamed tissues anywhere in the body. The stem cells naturally home in on the specific areas requiring intervention.
That is wild. The ultimate test case for this in the data is diabetes, and the pricing structure in Bangkok is fascinating. It ranges wildly from $8,000 to $30,000.
The diabetes divide.
Yeah, that massive price variance exists because diabetes is essentially an umbrella term for two entirely different mechanical failures requiring completely different biological strategies.
The contrast between treating type 1 and type 2 diabetes perfectly illustrates the sophisticated nuance of this medicine.
Let's dissect type 1 first. The biology of type 1 is fundamentally an immunological error. The patient's own immune system, specifically the T cells, has misidentified the insulin-producing beta cells in the pancreas as a deadly foreign pathogen.
Yes, it relentlessly attacks and destroys the very cells keeping the patient alive. The body is effectively at war with itself.
Exactly.
And because it is an autoimmune condition, using the patient's own autologous stem cells is often futile.
Because their immune system is the problem.
Right. The patient's immune system already possesses the aggressive memory required to attack pancreatic tissue. If you extract their cells, multiply them, and put them back, you haven't solved the underlying software error.
The immune system will likely just resume the attack on any new tissue.
Therefore, treating type 1 diabetes necessitates the use of potent allogeneic umbilical cord cells.
The donor cells. So the goal isn't just to build new pancreatic cells.
The primary goal is profound immunomodulation. When those donor cells are introduced systemically, their paracrine signaling works to effectively reboot the faulty immune system.
Reboot it. Okay.
They can induce apoptosis, which is programmed cell death in the aggressive T cells. And they shift the body's macrophages from a pro-inflammatory state to an anti-inflammatory state.
So they are attempting to reprogram the immune software so it ceases the attack on the pancreas while simultaneously attempting to regenerate the damaged beta cells.
It is a highly complex, dual-front biological intervention requiring specialized donor cells, which dictates the higher end of that price spectrum.
Here's where it gets really interesting. I look at it like a car engine. Treating type 1 diabetes is like realizing the car's internal computer has been hacked and is actively directing the engine to self-destruct. You have to completely reprogram the software.
That's a brilliant analogy.
But type 2 diabetes is a totally different mechanical failure.
Correct. Type 2 diabetes is a metabolic syndrome. In most cases, the pancreas is still fully capable of producing insulin. The failure is that the body's cells have become resistant to it.
They are ignoring the chemical signal to absorb glucose.
Yes, and this resistance is heavily driven by chronic, systemic inflammation, obesity, and lifestyle factors.
So going back to the car analogy, the computer is fine, but the spark plugs are fouled with carbon buildup and the oil is sludge. The engine is just running terribly.
That is an excellent way to conceptualize it. Therefore, treating type 2 diabetes often doesn't require an immune system reboot.
Okay, so they can use the cheaper cells?
Yes, clinics can frequently utilize the patient's own autologous stem cells extracted from their fat tissue. The biological objective here is to deploy those cells systemically to aggressively reduce chronic inflammation throughout the vascular system.
Because that inflammation is what's causing the insulin resistance.
Right. It improves blood flow and enhances the function of the existing pancreatic cells. By resolving the systemic inflammation, you can restore the cell's sensitivity to insulin.
It is a metabolic cleanup operation rather than an immunological overhaul.
Exactly. It is incredible how the same foundational biological tool can be deployed so differently based on the disease pathology.
We've moved from physical trauma to chronic metabolic disease. But the fastest growing sector in these Thai medical directories pushes past treating explicit illness entirely.
Yes, the frontier of regenerative medicine.
We are entering the frontier of preventive wellness and anti-aging, pushing into preventing the decline of aging itself.
The pursuit of longevity and systemic rejuvenation. This is where the intersection of advanced biology and medical tourism is seeing exponential growth.
The PlacidWay data lists comprehensive longevity packages starting around $4,200. But what does longevity treatment actually mean in a clinical setting?
We aren't talking about science fiction immortality.
No, we are talking about combating the specific biological mechanisms of aging. And that requires understanding a term that pops up constantly in longevity research, which is inflammaging.
Inflammaging is arguably the primary driver of physical decline. It is the concept that as we age, our bodies suffer from chronic, low-grade inflammation.
Right.
We accumulate what are known as senescent cells, often colloquially called zombie cells.
Zombie cells. I've seen that term used a lot online.
Yes. These are cells that have reached their replication limit.
Mm-hmm.
They stop dividing, but they refuse to die. Instead, they sit in our tissues and secrete a highly toxic cocktail of inflammatory molecules.
That's the SASP, right? The senescence-associated secretory phenotype.
Precisely.
So these zombie cells are just continuously leaking a low-grade poison into the surrounding tissue, creating a smoldering fire of chronic inflammation that never goes out.
That is exactly what happens.
And it damages blood vessels, degrades joint tissue, and impairs brain function over decades.
Yes. When a patient receives an IV stem cell infusion designed for longevity, those highly potent MSCs act as a systemic fire extinguisher. They circulate and aggressively target those areas of chronic inflammation.
Seeking out that fire.
They downregulate the toxic signals emitted by the senescent cells. Furthermore, they secrete vascular endothelial growth factor, or VEGF, which promotes cellular renewal.
That promotes the growth of new, healthy microblood vessels, right?
Yes, significantly improving oxygen and nutrient delivery to aging tissues.
So what is the tangible result for the patient? If I put out that smoldering internal fire, what do I actually feel?
The clinical anecdotes and patient reports consistently highlight a profound lifting of cognitive brain fog.
Oh, wow.
Patients experience sharper memory recall and improved sustained focus, largely due to the reduction of neuroinflammation and improved cerebral blood flow.
And physically.
Physically, they report a massive restoration of baseline energy levels, improved sleep architecture, and significantly faster recovery times from physical exertion. It is essentially recalibrating the body's internal environment back to a younger baseline.
And naturally, if you are fundamentally improving the vascular health and cellular efficiency of the internal organs, that vitality is going to reflect on the exterior.
It absolutely will.
Which leads us to the aesthetic applications in the data, specifically hair loss regeneration.
A very popular procedure in Thailand.
Yeah. Targeted scalp treatments are listed between roughly $1,900 and $3,200.
The mechanism here is a perfect illustration of localized vascular repair. Androgenic alopecia, or common hair loss, doesn't always mean the hair follicle is completely dead.
What's happening to it then?
Very often, the dermal papilla cells at the base of the follicle have simply gone dormant. They are choked by localized inflammation and a lack of adequate microvascular blood flow. They are essentially starving.
So the clinic extracts stem cells, either from a mini liposuction or sometimes via specialized advanced blood draws, processes them, and injects them directly into the scalp matrix.
Yes, to wake up those dormant hair follicles. The goal is to flood that barren dermal environment with a massive concentration of growth factors.
To feed them.
The stem cells stimulate immediate angiogenesis,
Yeah.
building new blood vessels to feed the starving follicles. They reduce the microinflammation, and they biochemically signal those dormant dermal papilla cells to exit the resting phase and re-enter the active growth phase.
Leading to natural regrowth and thicker hair. It is biological fertilizer for the scalp.
Exactly.
But I have to play the skeptic here. When you look at the thousands of dollars spent on these anti-aging and aesthetic protocols, is this just expensive vanity? Are there true medical benefits to these anti-aging protocols?
It is a vital question to ask. But we have to recognize that the aesthetic benefits, the better skin, the thicker hair, the increased mobility, they are simply the visible lagging indicators of profound cellular repair.
The visible byproducts.
Right. Your skin does not regain elasticity because it was painted with a chemical. It regains elasticity because the microvascular network beneath it was rebuilt and systemic inflammation was extinguished.
Well, I see.
The hair follicle regenerates because the cellular environment is fundamentally healthier. The vanity aspect is merely the external proof that the internal biological machinery has been optimized.
The outside is just a mirror of the inside. The true medical benefit is the mitigation of chronic disease risk that stems directly from that systemic inflammation.
Exactly.
Okay, we have covered the biology, the economics, and the clinical applications. If the listener is sold on the idea, how do they actually execute this trip safely without getting scammed or hurt?
This is the most critical phase of the medical tourism journey. The patient must transition into an aggressive, uncompromising advocate for their own health.
You cannot rely on a glossy website or a persuasive sales representative.
No, you must demand empirical data.
We talked about JCI accreditation earlier as the absolute baseline for hospital safety, but if a clinic is manipulating biological material in a lab, what other specific certifications should a patient be demanding to see?
You need to look for laboratory-specific accreditations. AAALAC is a crucial one.
What does that stand for?
It ensures the ethical and rigorous standards of biological research facilities. You should also demand to see OECD GLP certification, which stands for Good Laboratory Practice.
Right.
These are not easily acquired plaques. They require constant, rigorous auditing by independent international bodies.
Yeah.
Beyond the facility, you must ruthlessly vet the physicians. Are they board certified in a relevant specialty? Do they have a documented, peer-reviewed track record, specifically in regenerative medicine?
You should be asking the clinic for long-term outcome data and specifically asking about their complication rates. Transparency is the ultimate indicator of a legitimate clinic.
Absolutely.
And we also have to talk about the hidden financial realities. I mean, the PlacidWay directories are fantastic for establishing baseline medical costs. A $4,500 treatment package looks incredible on a spreadsheet compared to U.S. prices, but that is just the medical line item.
The true cost of medical tourism encompasses a massive logistical footprint.
Exactly. A package sounds great, but does it include flights, travel insurance, visa fees, accommodation, and daily meals?
You have to calculate all of that.
Almost certainly that $4,000 base price does not. Have you factored in the cost of comprehensive medical travel insurance, which is absolutely non-negotiable? What about the cost of a companion traveling with you?
If you don't calculate the total holistic cost of the journey, an ostensibly affordable medical intervention can rapidly devolve into a stressful financial burden.
This logistical complexity is exactly why the top-tier Thai clinics heavily promote all-inclusive medical packages. The data highlights comprehensive programs, like a 5-day autism care package or a 7-day kidney disease program.
And from a patient perspective, bundling the medical care like that provides critical predictability.
It simplifies the journey.
Yes, an international patient is already dealing with the anxiety of a medical procedure and the stress of a foreign environment. A comprehensive package typically bundles the initial specialist consultations, all of the exhaustive pretreatment diagnostic imaging and blood work, the actual stem cell harvesting and processing, the clinical procedure itself, and most importantly, the daily post-treatment monitoring.
And many premier clinics integrate this with partnered hotel accommodations and airport transfers. It removes the logistical friction.
However, the patient must still demand a fully itemized list of every single inclusion and exclusion before signing anything.
Read the fine print. Let's also confront the biological reality of the recovery. The marketing brochures often feature photos of patients smiling on a beach the day after their injection. But no biological intervention is without a physiological toll. What are the actual risks and the immediate side effects of these therapies?
While autologous and properly screened umbilical cord therapies possess a remarkably high safety profile, you are actively initiating a massive biological event inside your body. The most common immediate side effects are mild pain, swelling, or bruising at the extraction or injection sites.
Okay, that sounds manageable.
Furthermore, patients frequently experience a temporary low-grade fever, chills, or a profound sense of fatigue for 24 to 48 hours post-infusion.
I want to focus on that fatigue. Why does an injection designed to give you energy make you exhausted initially?
Because cellular repair is highly metabolically demanding. The infused stem cells are aggressively signaling your immune system to remodel tissue. They are commanding your native cells to synthesize new proteins and build new blood vessels.
Well, that's a lot of work.
That biological heavy lifting requires massive amounts of ATP, which is cellular energy. Your body essentially diverts its energy resources toward the repair process, leaving you feeling systemically drained. It is a sign that the biological machinery is working.
As the body begins the heavy lifting of cellular repair, it's the exhaustion of renovation.
Precisely. Now, the more severe, though rare, risks revolve almost entirely around infection.
Which is why we stress the laboratory standards.
Yes. If a clinic cuts corners on sterility, if they do not process the cells in a rigorous GMP-certified clean room, the risk of introducing a bacterial contaminant into the joint capsule or the bloodstream is catastrophic. This is why vetting the laboratory standards is non-negotiable.
And regarding the timeline, this is why the med holiday is not a luxury, but a requirement. Clinics generally mandate a stay of 1 to 4 weeks post-treatment for proper recovery.
They need to monitor your immune response, manage any acute inflammation, and ensure the cells are properly engrafting before you subject your body to the immense physiological stress of a pressurized long-haul flight home. You must commit the time to heal.
You cannot rush biology. Well, we have covered an immense amount of territory today. If we synthesize the data we've analyzed from these PlacidWay resources, a very clear picture emerges.
A very promising one, yes.
Thailand has managed to architect something truly remarkable on the global stage. They haven't just imported advanced regenerative biology, they have successfully merged high-tech, cutting-edge regenerative medicine with patient-centered hospitality and affordability.
Offering hope for everything from bad knees to chronic diabetes and overall longevity.
Exactly, and they have structured the economics to make these life-altering treatments accessible to a global audience that has been priced out of their domestic healthcare markets. They're offering highly calibrated biological interventions, not superficial band-aids.
It is a highly optimized, compelling ecosystem of care that challenges the traditional reactive medical model. Thailand's growing role in regenerative medicine reflects a larger global shift toward preventative healthcare, wellness optimization, and personalized treatment approaches.
For many patients, medical travel is no longer only about affordability, it's also about accessing innovative therapies in supportive healing environments.
Exactly.
So, to you, the listener, if you are exploring this path, whether you are actively managing a chronic condition, exploring preventive longevity protocols, or just fascinated by the future of medicine, the ultimate takeaway is this. You must become the CEO of your own healthcare journey.
Do your homework.
Demand absolute transparency. Force the clinics to provide their laboratory accreditations. Ask exactly where their umbilical cord cells come from and how they are screened for HLA markers.
And ensure you enter the clinic with a realistic expectation of the outcomes. Do not expect a magical cure. Expect highly advanced, targeted biology.
And as we conclude, if we zoom out and look at the macro implications of this data,
it raises a fundamental question about the future structure of global health. This is something important to mull over. As regenerative therapies become increasingly targeted, demonstrably effective, and remain highly cost-efficient in specialized international hubs like Thailand, will medical tourism transition from a niche alternative to the standard operating procedure for health management? In the coming decades, will we only utilize our local domestic hospital systems for immediate acute emergencies, stabilizing a heart attack or setting a broken femur? While all of our long-term preventative maintenance, our chronic disease management, and our sophisticated anti-aging protocols are executed exclusively on a tropical coastline halfway across the world.
Are we looking at a rapidly approaching future where your neighborhood doctor is basically just an emergency mechanic who patches the drywall, but you board a 15-hour flight to Bangkok to fundamentally rebuild the biological foundation? That is an incredibly provocative thought to leave on.
It really is.
Thank you for listening to PlacidWay Pulse. If you're exploring stem cell therapy, regenerative medicine, or medical tourism opportunities abroad, visit PlacidWay.com to learn more about treatment options, healthcare destinations, and patient resources designed to help you make informed decisions.
It's an invaluable resource.
Be sure to subscribe to PlacidWay Pulse for more conversations and insights on global healthcare innovation, wellness travel, and emerging medical treatments around the world. Until next time, stay informed, stay empowered, and take charge of your healthcare journey.